Welcome. Hey, here we are. Another day, another block. COVID-19 healthcare news. The healthcare system seemed to be an anomaly. It's everything. It's always in use. It rakes in tons of revenue. A pandemic can change that point of view, though. How do we know that? How often do we figure out we won't be able to watch sports for a long time? National Basketball Association is canceled. Baseball canceled. What else? We can't watch TV and watch sports right now? COVID-19? Huh? When Rudy Gobert tested positive for COVID-19, there was a sense, a brief moment of national panic. The Utah Jazz center had been in close contact with his teammates, staff, and autograph-seeking fans. He had touched door handles, basketballs, microphones, tape recorders, potentially spreading the coronavirus to hundreds of people. Conference time. Emergency time. Who is Rudy Gobert? Gobert, on NBA.com, is number 27, center, Utah Jazz. Basketball team where they wear the yellow jerseys, you know. He was actually drafted 2013 round 1 pick number 27. 15.1 points per game, 13.7 rebounds per game, 1.5 assists per game. It's pretty tall too. 7'1", 258 pounds. Okay, from France. That's who Rudy Gobert is. The NBA was aggressive when they figured out he had been tested and figured out he was positive for COVID-19. In a matter of hours, 58 tests for the virus were completed on players and personnel from the Utah Jazz. Members of the Toronto Raptors who had played the Jazz recently were given precautionary tests as well. One of Gobert's teammates, Donovan Mitchell, tested positive too. The rest of the tests came back negative. NBA nonetheless suspended its season. Woo! The NBA announced that due to the ongoing coronavirus pandemic, the 2019-20 season was suspended. It was placed into full effect March 12th, 2020. We have the best healthcare system in the world. We have fabulous doctors and healthcare facilities. In contrast, they're off limits to a lot of people because of the costs. Through a combination of front, side, and back doors, the rich haven't heard of off limits. But there are reasons why. Wealthy people tend to have better healthcare plans. Wealthy people are easily able to pay out-of-pocket expenses. The powerful, such as politicians, can leverage their position of influence. The healthy, or should we say the wealthy in this case, can donate their way into faster treatment. They're paying to be healthy like that. Executive individuals receive executive treatment. Is that wrong? It's not wrong, but we're just looking at our current situation with this pandemic virus. Now America's hospitals are bracing for a potential surge of patients. Nearly a decade ago, there was one individual, this is off of MSNmoney.com, Shao L. Clark, cardiology fellow at Stanford University, was a medical student at this time. He noticed something odd. This is a while ago. He said there was a patient who had a red blanket on their bed. The red bed cover marked the patient's status in that current hospital system. these patterns still occur. Most of the major hospitals in the country have some strategy now to just recruit patients in general, but to particularly recruit patients who are relatively well insured. You have nice insurance. Often, hospitals are specifically recruiting international patients to fly over and pay out of pocket. Patients who can pay more by giving them luxurious treatment to keep them, can keep the lights on in the hospital. That could be ranked as being unethical. They're trying to pay the bills. Everything isn't government paid, is it? Shaw L. Clark said, "What we're facing right now is unlike anything I've ever experienced in medicine. Our motivation should be driven by public health. And for people who are coming in potentially with COVID-19, it doesn't matter if they're a CEO of a big tech company or a homeless person off the street. They need to be appropriately cared for." As I said, this is msn.com/money. It has been noted that members of Congress have care immediately on hand through the Office of Attending Physician, a fully staffed office that can make recommendations to send lawmakers to a world-class hospital for top-of-the-line care. They're deliberating on what to do about a virus that will affect their constituents very different ways from how it will affect them. Hospitals have to keep close tabs on occupancy rates. What's going to happen with this wide-range testing of the COVID-19 virus is the fact that they're going to find more people that have it. So more people that have it, they have to be quarantined or self-quarantined for 2 weeks at a time. So these 2-week patients that are going to be heading to the hospital are going to have a long line. They're not just going to take the lines just as people come in. The hospital and the system itself is in place and knows what to do, and they have been thinking about this for a long time. As according to SiteMinder, they take into consideration average monthly occupancy, the number of rooms that are booked over 30 days can be taken into account with the number of rooms on that hospital property. Okay, so with this formula, they come up with the percentage, which is their occupancy rate. Okay, the occupancy rate is one of the most high-level indicators of success. And success for a hospital means treating those who need to be treated. They have to keep this in mind. This is from SiteMinder. This is copyrighted 2020. COVID-19 will be felt most by those least able to afford it. Those who don't have a lot of money stashed away could really find themselves in a very dire situation. Doesn't necessarily mean those who are already in a dire situation, but people that maybe were making ends meet, working day to day, you know, paying other things that need to be paid according to our priorities, and keeping their savings in mind, might not be able to save now if they find themselves in a situation, or not even just saving, just trying to keep ahead of paying things that have to be paid. Those who don't have a lot of money stashed away could really find themselves in a dire situation, as I said. But progressives have argued that this pandemic is the perfect example of why America needs a robust new healthcare program such as Medicare for all. It does sound awesome. More tests, there will be more confirmed cases. It's not a question of if, but how many. What happens after that, whether or not families are able to afford treatment, is less clear. The coronavirus exposed America's healthcare disparities, but America's healthcare has been placed with its problems in bold lettering. The healthcare system has to be improved. The Rudy Gobert situation was easy. The state knew of a person with COVID-19 and knew a lot about the people with whom he had made contact. Each of those people was at high risk. This case is rapidly changing, though. As you've heard about the drive-through testing, this is supposed to come to most every state that we could think of. This is according to the postgazette.com in Pittsburgh. This is reported on 3/16/2020. The Pittsburgh region got a small taste Monday of just how desperate people are to be tested for COVID-19 when the region's first drive-through test site opened in the North Shore area. With little notice beyond social media posts and a few paragraphs on news websites that night before, the Central Outreach Wellness Center, a nonprofit health clinic on the North Shore, screened about 150 people in just 2.5 hours on that Monday, ultimately taking samples to be tested from about 75 of them, said Dr. Stacy Lane, founder of the clinic. That's nice to know. By 1:30 that day, they were out of test kits and had to start turning people away at all 3 locations, Dr. Lane said. Though she hopes to have more in the coming days to be able to open up the drive-through test site again. Dr. Lane said the idea to have drive-through came last week when word got out that we had testing available here through Quest, when we realized no one else was able to test people without doctor's notes but us. We realized maybe we should be testing everyone we could, she said. The goal, she said, was to avoid having people go to their doctor's office and contaminate the office to get a note. So the drive-through testing will solve a lot of problems, and it'll help hospitals that really need to help the people that really need more help than everybody else. And at this point, it seems like it's the senior citizen population. The rest of us can just stay at home and self-quarantine for 2 weeks. That would be really awesome for the people that are in a situation where they really need health care. As more people have symptoms, both rich and poor decisions will be made. These decisions should be well thought out, meaning if you're okay, just stay at home for 2 weeks. But if you're not, you really need help, find a hospital, call 911. There's a very vulnerable population. There are people with fewer resources. There are also people that have relatively unlimited resources. COVID-19 is bringing them all to light. This pandemic will change our viewpoint of the current American healthcare system. So for a lot of people, the current system needs to be changed. For a lot of people, the current healthcare system is okay. COVID-19 is here. Hopefully it's not here to stay. Thank you.